Hi, everyone. Good morning. Um, Kind of excited to do this little presentation with you all. So Matt, who's done a couple of presentations already this week, asked me to do this when there was somebody who dropped out, and I said, sure. So my name is Marijke, and I'm an epidemiologist. I do work for the Minnesota Department of Health, but all of this is just my own personal thoughts today. So I'm not representing the health department in any way, shape, or form. I do want to make sure that that is very clear. So this is just my opinions and thoughts based on my work on COVID. And I do have a short, just kind of like, these are the things that people generally have asked me about in my normal life about COVID. And so these are just, again, things I think people maybe are interested in, but I'm hoping that most of this will be questions from people asking me. All right. So kind of some of the things that have come up with COVID is the difference of isolation and quarantine. And what are these words and do they mean the same thing? People use them interchangeably, and that is a huge pet peeve of mine because they mean different things and words matter. Words are important and they kind of change why somebody is doing the action that they're doing. And so using the right word makes it make a lot more sense. So isolation is for people who are sick or infected. So if you are sick or infected, then you're going to be asked to isolate. Quarantine is for exposed people, so people who are exposed to sick people while they're infectious, but who are not sick themselves and are not positive. So they haven't tested positive. So that's super important, and it really changes what those two different things are. So you might be taking the same action, you're staying at home, but the reason why you're doing that action is completely different. So for isolation, the goal is to keep the infectious people away from the people who can be infected. So we want to keep, you are infectious, we want you away from other humans and animals. So the infectious period for COVID, from what we know so far, it usually starts about 2 to 3 days before you have symptoms, if you're going to get symptoms. And then it lasts for around 10 days after your symptom onset, if you have symptoms. And this is generally as long as your symptoms are improving. But it also, you need to be fever-free for 24 hours and generally also starting to feel better. So not all of your symptoms gone, but starting to feel better. And that's for your average human, just regular person. If you have a more severe illness, if you're hospitalized, if you have any kind of immunocompromising conditions, it's going to be longer, and you should work with a physician or a nurse on when you can be released from isolation. So this is kind of just your standard. And this is based off of a pretty small study, but it was pretty rigorous as well, looking at live virus in people and trying to see when they could no longer find live virus. And that's different than testing positive. You can test positive for months. You can test positive quite literally for well over 6 months. So you could still have little bits of viral RNA, but you're not infectious. So no live virus has been found after 9 days, which is why we say 10 days for when you are out of isolation. During that time period, we want people to isolate away from their household members. So isolation means like for real isolation, like going into the basement or into a bedroom that has a bathroom that no one else is using. People are not doing this, thus we have outbreaks among family members. So if you can isolate away from everyone in your household, that is much better. You should start isolating as soon as you have any symptoms. So not until you get a positive test result. That should happen as soon as you start having symptoms. You should be like, I am infectious to the people around me and I don't want to get them sick. So this is more than you would normally do probably, but also COVID is different than every other disease. So. And we don't recommend testing to clear. Like I said, you can test positive for months and months and months. So we don't recommend, if you have a positive test, going back to get a negative test in order to go back to work or back to other activities. Not recommended at all. So quarantine. This is, you were exposed to somebody who was infectious, and we want to keep you away from everyone else in case you become infectious. So like I said, you're infectious 2 days before you start to have symptoms. So we want you to be separated from everyone else in case you should become infectious or develop symptoms. So if you're exposed to somebody while they're actively infectious, we want you to stay away from everyone else while you're potentially incubating the virus. So the incubation period is up to 14 days, but really we're seeing 5 to 7 days is the most common. So if you were around somebody who was infectious, 5 to 7 days later, you're likely, well, if you were infected during that interaction, that's when you would start to become symptomatic. Again, you're infectious 2 days before that, though. So during quarantine, it's really best to assume that you were exposed and you could become infectious at any time. So you should be, again, away from the other people in your household as much as possible. We do recommend that you get tested during that quarantine period, again, probably around that 5 to 7 days after your exposure. But a negative test does not mean that you don't have to quarantine, because you could develop that infection. You could have more virus incubating and becoming live at any point inside. So you want to make sure that you're quarantining for that entire 14 days. And if you develop symptoms, then you go into isolation. So that extends that time period. So that's kind of isolation and quarantine. How does contact tracing work is another thing. So this is my very minimal timeline, but basically you become infectious 2 days before, you may or may not develop symptoms, maybe a day or two later you get tested, then you get your test result. So that's the human side of things. And that's happening in like day -2. Day 0 is the day that we consider that you got symptoms. So that's your day 0 at it's easier for counting if you call it that. And then, so now you've gone in and you've gotten tested. Maybe a couple of days later, you'll get your lab results. Depends. Sometimes it's the same day. Sometimes it's a week later. Depends on if you go to a clinic that is doing testing in-house or if they're sending it out. We have a lot of pain clinics that have recently converted from doing drug testing to doing virus testing. They're maybe not the greatest at reporting. So just, think about where you're getting tested. Is it a reputable clinic? I would probably recommend that on a personal level. And then they report those to the Minnesota Department of Health in various methods. So some of them are electronic lab reporting, in which case it comes in multiple times a day from their lab into our system. Some send like a flat Excel file daily. Some people fax us still. So again, whichever kind of medical system you're in, you might get faster or slower reporting. That report is compared to all of our previous reports. So maybe this is the 8th time that you've been tested, and you gave us a different address and a different phone number every time. We have to mash those records together. A lot of ours come in with no address or no phone number. So around 15%, or the wrong address or the wrong phone number. So, data quality is an issue that we are working on to get better data from all of our laboratories. Once we get that information, if we have the right phone number, then we try and give people a call. And then we do a standard interview, and we attempt to determine where you got infected and who you infected. So if that's pretty easy, if you had a household member, you still do the full interview, but we know that you probably got it from your household member. And then we try and figure out who you exposed. And so that information, we ask you to get in touch with your household and just tell them to quarantine. And then any other social contacts, if you're able to provide the quarantine information, that is much preferred, just because of the sheer numbers. I think, we've been well over 1,500 cases a day. That's a lot of social contacts, because most people have around 15 to 20 social contacts that they were around, which is not awesome. But if you were in your workplace, or say you live in some sort of, or you live or work in a congregate setting, like a prison, jail, long-term care facility, group home, university dorm, those types of things, we do have special follow-up teams that work with those facilities in order to get additional contact tracing done. Same with sports teams and healthcare facilities. So if you were in a healthcare facility, you probably exposed some people there. So those are kind of like the overarching things, but like, what should I do? I'm just a regular person. What should I do to help stop the spread of COVID? So some risk reduction strategies. I recommend keeping your contact circle small. So your household and potentially, you know, some other friends or family in order to stay mentally healthy as well. You want to make sure that your contacts are also engaging in behavior that is at a risk level that you're comfortable with. So some people have to go into work. And, you know, if you work in a hospital, you have to go into work at a hospital, but maybe that person is a person who you don't have indoor contact with then. So you're trying to keep people who have more riskier contact, you're going to have less risky contact with them. If you're going to, again, I don't say don't have any get-togethers, like don't have any gatherings. That's not safe either because, you know, we're social creatures. But if you are having gatherings, make sure that they're small. Probably it's best to keep it kind of, you know, your same group of people, again, who are engaging in that same level of risk as you, and outside versus inside if possible. I know we're heading into a season where that's going to be really uncomfortable. Wear a mask if you're around people. So, you know, unless you're very far from people, you should be wearing a mask. It does reduce the risk that you're going to transmit to them and also that they could transmit to you. It is selfish too to wear a mask. It's not just selfless. If you do start to have symptoms, get tested. If you have a known exposure, get tested. If you don't have any known exposures and you don't have symptoms, don't get tested. Like I know that you can, it's fine if you do. Honestly, it doesn't really do anything. I don't quite understand why people are just like, hey, I'm going to go get tested this weekend. You're like, what are you going to do with that information? Like a negative means nothing. A positive means something, but a negative means nothing. To me, it just is a little bit confusing. So I haven't been tested because I haven't had any known exposures. I haven't had any symptoms. So here we go. And then, you know, again, like I said, mental health is also part of this. So make sure that you're assessing your mental health regularly and trying to take actions that will keep you healthy in that manner too. Things not to do. Don't host large events and don't go to large events, even if they're outside. Like, don't. So many weddings, so many parties, so many bars, and that is just don't. I don't know. If you have like multiple friends and groups and stuff that you're interacting with, that's not awesome. You know, especially if you know that there are people in those groups who are kind of ignoring this and pretending like COVID is over. That's just going to increase the risk for, you know, you could be the transmission between two groups if that's the case. Again, don't get tested over and over again for no reason. If you happen to work in like a long-term care facility, they're going to test you over and over again. That's just going to happen. So that's not for no reason. You're working with a really at-risk population. But for just your run-of-the-mill person, there's not really a great reason to just be tested over and over again. Don't put off your regular medical care, like still go in for your physical and other things. I've been guilty of this. I need to go to the dentist and I just haven't, but I was scheduled in April and nothing was open in April. So, but those types of things, like you should still be doing those. Get your kids vaccinated, please. Like vaccinations are super down, which is not good. And then don't isolate to the detriment of your mental health. So, you know, don't just stay at home away from everyone. Make sure that you're still making time to see people, even if it's on Zoom or something like that. So this is another one that has come up. Like I have this thing, I'm supposed to do a thing. My family is requiring that we do a thing. It's going to be a bunch of us together. Something risky is happening. What can I do to make this less bad? So this is kind of risk reduction. So I think in the US, we're really good at like abstinence only type of things. And that's just not going to work in this case. Like we're in this for the long haul. It's going to be around for years, folks. I'm sorry. But we just want to be extra cautious if you're going to be doing something, especially around older folks. If you're going to be around grandparents or parents that are in the 70 plus age group, before you see them, just be extra cautious for those 14 days. So that's that incubation period. So that would be, really not seeing anyone outside your house, doing grocery delivery instead of picking things up, or stocking up for those 14 days and then not going anywhere. You can still go outside, just don't be around other people. And then towards the end of your quarantine, you could consider getting a test just as a precaution. But again, the negative doesn't mean anything except for you were negative at that very moment. So you could still become infectious later. But since you were quarantined, that's a lot less likely. So I would say that if you are going to do something where you're going to be around a large group of people, if you can get everyone to agree to quarantine for the 14 days before, get tested in those last few days, then it is really reducing the risk that there's somebody who's infectious there who's going to get everyone sick. Try and keep your distance when you're at the thing, even though everyone got tested, everyone quarantined, so that if that's possible. Again, it might not be, but that's another way. And then after the thing, you should also quarantine again, because you could have been exposed at that thing. So again, consider getting tested again. So I would say that that's a pretty big investment, right? You're saying 2 weeks before the thing. At the thing, you're going to still try and keep your distance as much as possible. And then 2 weeks after the thing, you're also going to quarantine again. So, that's a whole month that you're setting up of being home and like really strictly at home, not this kind of like stay at home-ish, be less around other people. So I would say consider making those things really, really rare and very important things only. And again, you should be doing all these things, and also everyone that you are hanging out with at the thing should be doing those. So those are all the slides that I have, but I'm open to all of the questions. Oh my gosh, okay, there's already questions. Okay, so let's see. Advice or recommendations on how to stay sane during the winter in terms of safe indoor activities with kids. I mean, any of the things that we did in April, there was lots of puzzles and lots of other activities. I think if you can figure out a way to do things over Zoom with other people, then that would be, or other platforms, whatever platform you would like with other people. And again, I'm going to say very clearly, I am not speaking on behalf of the Minnesota Department of Health, but if you can have a group of people that are doing the same things as you, then it is more safe to do those indoor activities with them. So you can have people over as long as you're kind of considering them, like knowing that if they get sick or if you get sick, like you're all going to be in quarantine or isolation. So, just considering that when you do it. How risky are these activities with kids? Playing on a playground, I would say that's not terribly risky. The UV also will denature the virus, so that's not risky at all, especially if you have hand sanitizer. They're going to be close to the other kids, but I would say that outside, probably fine. Petting the same cat as other households, I would not consider that extra risky at all. Playing but 6 feet apart with lots of yelling. If it's outside, that's probably okay. The yelling is gonna, spew some virus out there, but they're staying 6 feet apart. That's gonna reduce the risk of transmission, and outside any droplets are gonna be blown away. So medium risk on that one. And then, oh no, it went away. And then playing in the snow, but with gloves on. Yeah, I would say that all of those seem like pretty okay things to do. Like it's not going to be zero risk. We're never going to get to that, but lower risk. How do you know if it's safe to eat indoors? It's not. It's not safe to eat indoors at restaurants. I would not do it. I have not done it. I would not recommend it. Takeout, it's really great. Takeout is wonderful. Yep. Related to the indoor question, how can the average parent tell the difference between a normal cold and COVID during winter months? It's not possible to tell the difference, unfortunately, especially with kids. The symptoms can be just super mild. So people, they're gonna, hopefully they won't be getting sick as much because they're staying at home. If you're in greater Minnesota, they might be going to school, but I think all of the metro schools are mostly on hybrid or at home. So yes, I would say that you should consider getting them tested if they start to have any type of cold symptoms. I know that might be getting tested a lot, but better that than not. And if they do have COVID, then they'll come up positive. It's really rare to get false negatives with the PCR tests. So there's two types of tests. There's antigen tests and PCR tests for the virus. The antigen tests are not awesome. especially if you don't have symptoms. They were only tested in people who had symptoms, and were only tested in people who had symptoms in the last, onset within the last 2 to 7 days. So they're mediocre at best with people. I don't actually know if they were even tested on kids. But the PCR test, it's really, really rare to get a false negative. So if you get tested, then you should be okay. And yeah, no, PTO is going to be a problem for sure. But I would say that if your kid has any type of cold symptoms, consider getting them tested. If they come up negative, then they should just be symptom-free before they go back to school. Because like always, I know that that's not done, but you should not send your kids to school when they're sick or have any sort of illness. I usually work in foodborne illness, and boy, people send kids to daycare with diarrhea all the time, and that is not a good idea either. I'm just going to put that plug in while we're here. If you have to travel, what is the safest way to travel? Safest way to travel would be in your own personal vehicle or plane. I don't know, if you have a personal plane, go for it. Traveling by commercial air is just going to be inherently risky. I'm not going to do it for the near future. But driving would be better. And again, quarantining before and after. So if you're flying to go see family and your family is elderly, it's not great. Unless you can have 2 weeks or at least 10 days of quarantining away from them. Let's see. This keeps moving on me. Okay, do you see a place for the rapid antigen tests and having people over in addition to isolating and PCR, so family holiday times? So I think the tests are a tool, but more important is the time period leading up to the family get together and then the time period after. So time period leading up to the family get together, if everyone can be really good about quarantining, and so assuming that they are exposed or are infectious and staying home during that time period, getting tested towards the end to kind of get at least a snapshot. And then while you're together, trying to do some risk reduction. So, I'm not saying don't hug them. I'm just saying don't spend a ton of time face to face with people as much as possible. And then again, quarantining afterwards. So the antigen, there are rapid PCR tests too. So it doesn't really matter which type of test you get. A PCR test takes a day to run when the labs are appropriately have the right amount of materials. So how can the average person tell the difference between a cold and COVID? Oh wait, we already did that one. Sorry. Should you be wearing a mask outside? If you're going to be near people, yes. So if you are going to be walking on a busy pathway where there's a likelihood that you would be within 6 feet of somebody for a period of time, not even that 15 minutes, just some period of time, then I would wear a mask. If you're going to be on a busy street where you're going to be passing a bunch of people, yes, that is both for their protection and then also your protection. It does provide a barrier so that it is, if somebody's walking by you while they're infectious, you're less likely to get infected yourself. But if I'm out on a solo walk, not in a busy neighborhood, I don't wear a mask. And I bike to work every day, and I don't wear a mask when I'm biking to work because no one else is around me. For food and diet, I don't think that there's any type of strong correlation between somebody's diet and whether or not they become sick with COVID. So I think in general, if you have an actual immune deficiency, then you're more likely to become more ill. So if you're immunocompromised, that's the possibility that you would be more likely to become infected and more likely to have more severe illness. We don't have a ton of data on that, but kind of your regular run-of-the-mill person, there's not a strong correlation that I know of between diet and and how sick people become. It does seem pretty random. One of our earlier cases, and they've been in the media, so I can talk about them, was a triathlete. Like, he did multiple triathlons and ended up in the ICU for over 40 days, but he lived. So, and then, there have been other people who are generally pretty healthy and then they die. So we've had, I think, 5 to 8 deaths in the 30-year-old range, and not all of them had pre-existing conditions. So seems really random who gets sick and who doesn't. Long-term effects of COVID. So I love when this question comes up on interviews that we're doing, and people, I was doing interviews in March and April. I have graduated and no longer have to do those, which is wonderful. And people were asking this question then, and it's like, well, this virus has existed since December. So we don't know at all what any of the long-term effects are. So far, what we know from basically we have, 6 months of info on Minnesota. People do have long ongoing illness. So brain fog can continue for a long time. Some people have not gotten their sense of smell or taste back. There's evidence of heart, basically like similar to endocarditis. So having some ongoing heart issues, and then ongoing lung issues if you do develop pneumonia. So I would say the mortality is really scary, but that's really been mostly for older folks. That's where the large case fatality rate is. But ongoing illness is really happening in all age groups. So even if you have a mild illness, it could extend for an incredibly long period of time. So I don't love seeing all these like 20, 30, 40-year-olds who are like, nah, it's okay, it's not that bad of an illness. And it's like, first of all, you don't know if you're going to be that person. Like, people are like, only 1% of people under this age die. And you're like, yeah, but like 100% of you is dead if you're that 1%. And then even if that's not you, you could end up with really long-term illness and disability from it. We just don't know. Viruses behave so strangely. Like, you can get the flu and then get alopecia and not have hair for the rest of your life. But that's just a thing that happens. So I haven't seen anything about blood types since April, and I think that study was pretty weak. So I don't think that there's any evidence right now that different blood types are more likely or less likely to get COVID. Can you get reinfected once you've had COVID? No idea. Who knows? Right now, our case definition says that if you test positive 90 days after your initial infection, that you're considered you're possibly maybe considered a new case. But we don't have great evidence. We do have, I think that there's like less than 5 cases in the world where we've been able to do sequencing on their first infection and sequencing on their last infection. And for those, they've been different, but they didn't necessarily have symptoms again. So it's unclear at this point if you would be able to get infected again. We do consider that if you're within that 90 days, you don't need to isolate or quarantine again. If you test positive again, you don't need to isolate again. And if you're exposed to somebody, you don't need to quarantine again. So limited evidence that there is at least some immunity for possibly up to 90 days, but maybe longer. Do we think people are dying because they have DNRs? No, they're dying because they have massive pneumonia and can't breathe. Okay, I think that's it. Thanks so much, everyone, for all the questions. And I don't know, I think there's the potential that this might happen again at some sort of lunch thing. In the AMA. At an AMA, that's what I've been told. So thanks for all the questions, and I hope you all stay safe.